distribute the vaccine against the H1N1 swine flu, and in Indiana they started on Monday. People began receiving the spray vaccine today in DuPage County, for example, the health department in Wheaton. This Saturday, the Chicago Health Department begins offering free H1N1 shots at 6 city colleges. Will County Health Department says the free inoculations will be available beginning October the 28th. Lake County, Illinois, will begin vaccinating on October the 29th. Dr. Mayor Eisenstein from Home First in Rolling Meadows joins us now. You say, I've read your advocate, I've read your website, which advocates do not take any vaccines.
Yeah, say no to all flu vaccines, especially flu vaccines, because that's what we're really talking about now.
Why?
Well, first of all, it's the only infectious disease that we've known in the last 50 years where the vaccine has been available and most people have taken it, and the death rate from flu and pneumonia continues to increase.
But is there a correlation
well,
between
it's hard
the two?
to know there's a correlation, but I think it should be investigated. You know, everything else, polio, diphtheria, tetanus, the vaccine comes and the death rate goes down. But here's one that's just the opposite. You know, they keep saying, well, the strain is different, it changes, you know. But, you know, this is... we have a very serious problem here. No one should feel that I've minimized the flu vaccines, but they don't work. Or flu, it's a serious illness.
Yes.
The CDC says 36,000 people die every year. How come the number doesn't go down? Right now we have almost 75% of people getting flu vaccine. Why isn't the number 34,000?
So you don't have any scientific correlation that you've done or you've seen, but you're saying the numbers just don't seem to add up? Is that what you're saying?
I can't think of another disease that goes along with that. Every other one, the vaccine comes and the incidence gets less.
Okay, if I'm your patient and you say, no, don't take the seasonal flu vaccine, don't take the H1N1, what would you suggest I do as my doctor?
Two things very important. Number one, make sure you have adequate vitamin D levels. You've seen, I'm sure, many of the stories that the majority of Americans are severely deficient in vitamin D. It's partly because for 35 years we've been told you can't go in the sun, you know, and we put sunscreen which blocks the vitamin D. Get a vitamin D test. Everyone should get a vitamin D test. We just tested 100 patients in our practice, and 80 of them, even though I've talked about this for 2 years, 80 of them were low. The magic number, 60.
Why vitamin D?
Well, vitamin D is not a vitamin. It's actually a hormone. It modulates the immune system. And there's been evidence that it has been protective against flu and even swine flu. One of my dear friends from medical school is the medical director in Wisconsin, Madison, Wisconsin, in a children's hospital unit. And they had a bad outbreak of swine flu in the beginning of summer. He has 275 inpatient children. Only 2 out of 275 got the swine flu. 100 workers came down with it. And he's been measuring and watching their vitamin D levels for over 2 years. Not conclusive, but it's evidence. And I'm also an attorney. And evidence means one more nail in the coffin that vitamin D may be a very strong contributory factor to the high incidence of flu.
In the 30 seconds we have, so if the CDC head of it right here was sitting here, who advocated this morning, get both, the seasonal when it comes around and get the H1N1, you would tell him or her,
go ahead and get it if you want, but not for my patients, not for my family. You know, my family is going to make sure their vitamin D levels are high enough. They're going to make sure that they're eating well. They're going to make sure that they don't take aspirin, Tylenol, Aleve, all the things that the CDC is recommending. And the British Medical Journal has here a study showing that those things exacerbate deaths from flu. Japan in 2000 ended the use of routine lowering medication for fever. Their death rate from flu has plummeted since then.
Dr. Mayor Eisenstein, Home First, and it's homefirst.com?
Homefirst.com.
Thank you very much for joining us.
Thank you very much. Thank you.